Family nurse practitioners, or FNPs, are on the front lines of primary care. They see a wide range of health issues every single day in their clinics. Among the most frequent complaints are those related to the respiratory system. Patients often present with symptoms like a persistent cough, shortness of breath, or wheezing. So, having a strong and confident understanding of common pulmonary diseases is not just helpful, it is absolutely essential for safe and effective practice. This knowledge forms a critical part of the FNP certification exam and daily clinical decision-making, ensuring that new practitioners can accurately diagnose, treat, and manage these prevalent conditions. This overview is designed specifically for FNP students preparing for their board certification exams. The goal is to simplify complex topics into manageable key information. We will focus on the high-yield facts that are most likely to appear on your test. This includes the most common conditions you will encounter, such as asthma, chronic obstructive pulmonary disease, or COPD, pneumonia, and tuberculosis. By breaking down each disease into its core components, pathophysiology, diagnosis, and treatment, you can build a solid foundation. This structured approach helps in retaining the information needed to answer exam questions correctly and with confidence. A deep understanding of pulmonary diseases directly translates into better patient outcomes. When an FNP can quickly recognize the subtle differences between an asthma exacerbation and a COPD flare-up, they can initiate the correct treatment much faster. This prevents delays in care and reduces the risk of serious complications, hospitalizations, or long-term lung damage. This review will provide you with the essential clinical pearls and evidence-based guidelines that are fundamental to providing high-quality care. Remember, mastering these basics is a key step toward becoming a competent and trusted healthcare provider in your community. The FNP exam tests your ability to apply knowledge in realistic clinical scenarios. It is not just about memorizing facts, but about understanding how to use those facts to make sound judgments. This guide will help you connect the dots between a patient's symptoms, their history, diagnostic test results, and the most appropriate treatment plan. We will cover the essential diagnostic tools like spirometry and chest x-rays, and we will outline the first-line medications for each condition. Think of this as your study blueprint for the pulmonary section of your exam, helping you prepare efficiently and effectively for success. Asthma is a chronic inflammatory disease of the airways. This inflammation causes the airways to become hypersensitive to various triggers such as allergens, smoke, or cold air. When exposed to a trigger, the airways narrow, swell, and produce excess mucus. This leads to the classic symptoms of wheezing, coughing, chest tightness, and shortness of breath. The symptoms are often reversible, either on their own or with treatment. Risk factors for developing asthma include having a family history of the condition, personal history of allergies, also called atopy, or frequent respiratory infections during childhood. It's a condition that typically starts in childhood, but can develop at any age. Diagnosing asthma involves a careful review of the patient's history and a physical exam. The key is to identify a pattern of episodic symptoms. During an examination, you might hear expiratory wheezing when you listen to the lungs with a stethoscope. The gold standard for confirming the diagnosis is spirometry. This test measures how much air a person can breathe in and out, and how fast they can do it. For asthma, we look for evidence of reversible airway obstruction. This means the patient's lung function, specifically the forced expiratory volume in 1 second, or FEV1, improves significantly after they inhale a short-acting bronchodilator like albuterol. Treatment for asthma follows a stepwise approach based on the severity and frequency of symptoms. The goal is to control the inflammation and prevent exacerbations. The cornerstone of treatment is an inhaled corticosteroid, or ICS, which reduces airway inflammation. For quick relief of symptoms, patients use a short-acting beta agonist, or SABA, like albuterol. For those with more persistent symptoms, a long-acting beta agonist, or LABA, may be added in combination with an ICS. Patient education is absolutely critical. You must teach patients how to use their inhalers correctly and how to follow their personalized asthma action plan. A key clinical pearl for asthma is the rule of twos. If a patient is using their rescue inhaler, or SABA, more than 2 times a week, waking up at night with symptoms more than 2 times a month, or refilling their SABA prescription more than 2 times a year, their asthma is not well controlled. This is a clear signal that their long-term control medication needs to be adjusted, likely by starting or increasing the dose of an inhaled corticosteroid. This simple rule is a very important concept for both the FNP exam and for real-world clinical practice. Pneumonia is an infection of the lung tissue, specifically the alveoli, which are the small air sacs. The infection causes these sacs to fill with fluid or pus, making it difficult to breathe. The most common type seen in primary care is community-acquired pneumonia, or CAP. Symptoms typically include fever, chills, a productive cough with yellow or green sputum, chest pain when breathing, and shortness of breath. In older adults, the only symptom might be confusion or weakness. Key risk factors for developing pneumonia include being very young or over age 65, smoking, having a chronic illness like COPD or diabetes, and having a weakened immune system. The diagnosis of pneumonia is primarily based on clinical findings from the patient's history and physical exam, and it is confirmed with a chest X-ray. During the physical exam, you might hear crackles or rhonchi over the affected area of the lung. You may also notice dullness to percussion. A chest X-ray is the most important diagnostic test. It will typically show an infiltrate or consolidation, which confirms the presence of fluid in the lung. For most healthy outpatients, a sputum culture is not necessary. The CURB-65 score can be used to determine if a patient can be safely treated at home or needs to be hospitalized. Treatment for CAP in an otherwise healthy adult is typically an oral antibiotic. The first-line choice is usually a macrolide such as azithromycin or doxycycline. For patients with comorbidities like heart or lung disease, a respiratory fluoroquinolone like levofloxacin or a combination of a beta-lactam like amoxicillin clavulanate plus a macrolide is recommended. It's also important to advise the patient on supportive care. This includes getting plenty of rest, staying hydrated by drinking fluids, and using medications to control fever. Prevention through vaccination, such as the pneumococcal and influenza vaccines, is a crucial part of patient education. Tuberculosis, or TB, is a serious infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs but can spread to other parts of the body. Many people have latent TB, meaning they are infected but have no symptoms and are not contagious. Active TB disease, however, causes symptoms like a chronic cough lasting 3 weeks or more, chest pain, coughing up blood, also known as hemoptysis, fever, night sweats, and weight loss. Major risk factors include being born in a country with high TB rates, living in congregate settings like shelters or prisons, and having a compromised immune system, especially due to HIV infection. Diagnosing TB involves several steps. The initial screening test is usually a tuberculin skin test, or TST, or an interferon gamma release assay, also called an IDRA blood test. A positive result on either of these tests indicates that the person has been infected with TB bacteria, but it does not distinguish between latent infection and active disease. To diagnose active pulmonary TB, a chest X-ray is required, which classically shows infiltrates in the upper lobes of the lungs. The definitive diagnosis is made by identifying the TB bacteria in a sputum sample through an acid-fast bacillus, or AFB, smear and culture. This confirmation is essential before starting treatment. The treatment for active TB is complex and requires a long course of multiple antibiotics to prevent the development of drug resistance. The standard regimen involves 4 drugs: isoniazid, rifampin, pyrazinamide, and ethambutol, taken for 2 months, followed by a 4-month continuation phase of isoniazid and rifampin. Adherence to this long treatment is critical, and directly observed therapy, or DOT, is often recommended to ensure patients take every dose. A critical pearl for the FNP exam is to know the major side effects of these drugs, especially that isoniazid can cause peripheral neuropathy, prevented with vitamin B6, and all can cause hepatotoxicity. Mastering the fundamentals of these common pulmonary diseases is a non-negotiable part of preparing for the FNP certification exam and for a successful career in primary care. Asthma, COPD, pneumonia, and tuberculosis are conditions you will undoubtedly manage. Being able to differentiate them based on patient history, recognize their classic presentations on a physical exam, and order the correct diagnostic tests is a core competency. This knowledge allows you to create safe and effective treatment plans that align with current evidence-based guidelines, which is precisely what the certification exam is designed to assess in all new nurse practitioners. Ultimately, this foundational knowledge builds clinical confidence. When you are faced with a patient who is struggling to breathe, having a clear and systematic approach allows you to think critically under pressure. You can reassure your patients, educate them about their condition, and empower them to manage their health effectively. For the FNP student, this means not just passing an exam, but being truly prepared for the responsibilities and challenges of clinical practice. Your ability to handle these common yet serious conditions will define your effectiveness as a provider and directly impact the health and well-being of the patients you serve.